Welcome to Season 2 of the IPE Guidebook. In Season 1, we built the case for interprofessional education. Now we get to know the people who actually do it. We start with a fundamental question: who's on a healthcare team? Think of a football team. A goalkeeper, defenders, midfielders, forwards, each with a distinct role, but all chasing one goal. A healthcare team works in exactly the same way. Different professionals, different responsibilities, united around a single aim: the patient's health. But here's something important: the lineup isn't fixed. For a common cold, the team might be just a physician and a nurse. For a stroke, it expands dramatically: a physician, a nurse, a physical therapist, an occupational therapist, a speech-language pathologist, a dietitian, and a social worker. The team is assembled to fit the patient. At the center, though, sits a core trio. First, the physician, who integrates symptoms and test results to reach a diagnosis and set the treatment plan, but never works alone. Second, the nurse, closest to the patient, around the clock, the one who catches the smallest changes first. And third, the pharmacist, who makes sure medications are safe and effective, and checks for dangerous interactions. So how is a team actually put together? 2 principles. The first, it's built around the patient. The basis is always the patient's needs, shaped by factors like the disease, its severity, and the patient's level of function, bringing the right people at the right time. The second principle, the team changes in stages. In the acute phase, the physician and nurse lead. During recovery, the therapists step forward. And before discharge, the social worker and dietitian come to the front. Composition alone doesn't guarantee success. 3 things make teamwork actually work. First, mutual respect and trust. The old mindset that the physician matters most and the nurse only assists actively damages a team. Second, a shared goal: the patient's health, placed above any single specialty. And third, communication, through meetings, electronic records, and standardized reporting, so that nothing important is ever lost. Let's recap. 1. A healthcare team is built around the patient. 2. Its composition shifts in stages as the patient's needs change. And 3. It runs on respect, a shared goal, and clear communication. In the next episode, we zoom in on the core clinical trio: the physician, the nurse, and the pharmacist, and look closely at how they work together. To go deeper, explore the full IPE Guidebook from Telios Books. See you in the next episode.